Yes, sir.
Okay, just a minute. Okay. So this will be an MCQ or paper solving session. So here we start with the first MCQ, right? Okay. So the question is, the following statements are true regarding plasmatocytes. First, it has a cartwheel shaped nucleus. Second, antigens are stored as inclusion bodies called Russell bodies. And third, cytoplasm is basophilic. Right? So these
सर
are
स्क्रीन
Questions are not showing on the screen.
सर
अच्छा
स्क्रीन पर सिर्फ एमसीक्यू पहली वाली स्लाइड दिख रही है.
अच्छा स्लाइड जस्ट अ मिनट. अभी दिख रही है स्लाइड.
Yes,
ओके. अभी मैं चेंज कर रहा हूं तो चेंज हो रही है.
yes, Shuru.
ओके ओके ओके. So so again, the following statements are true. So you need to identify the true statements, right? So regarding plasmatocyte, correct? So means ke plasma cells, right? So now you see statement number one, it has a cartwheel shaped nucleus. Then statement number two, antigens are stored as inclusion bodies called Russell bodies. And third statement, cytoplasm is basophilic. First, second, and third all are true. First and third are true, but statement number second, that is false. C, option C, that is 1 and 2 are true, and third is false. Option D, 3 alone is false, 1 and 2 are true. Okay. So anyone would like to answer? Dr. Poonam says B. Okay. Okay. Anyone else wants to try? Okay. Now let's try to understand what is these plasmatocytes. Plasmatocytes means plasma cells. These are special white blood cells that produce antibodies to fight infections, right? And Russell bodies are the small round structures seen inside the plasma cell. They are formed when too much antibody proteins gets collected inside the cell. If you know the central part under when you look under the microscope, right? So now, and the last statement is cytoplasmic basophilic. That means the inside part of the cell stains blue or purple when see under the microscope, right? So now let's try to solve this. I have changed my slide. Is it so? The first sentence regarding cartwheel shaped nucleus, right? So plasma cells have typically cartwheel shaped nucleus. So this statement is true. Second statement, antigen stores as Russell bodies. False. Russell bodies do not store antigens. They are actually accumulation of excess immunoglobulins. That means antibodies inside the cell. And the third sentence is cytoplasm is basophilic. Correct. That statement is true. So plasma cell have deep basophilic cytoplasm because they contain lots of rough endoplasmic rough endoplasmic reticulum, right? Rough and smooth endoplasmic reticulum. So they contains a lot of rough endoplasmic reticulum. So now you see option B, first and three are true, but the second statement is false. So the correct option for this MCQ, that is option B. Right? We move further regarding B lymphocytes. Right? So these are the statements regarding B lymphocyte, and you need to identify. You see, statements are true except, so you need to identify incorrect. Right? So first statement, that about 85% of the circulating lymphocytes in blood are B lymphocytes. तो फर्स्ट स्टेटमेंट ऐसा कह रहा है कि हमारे बॉडी में जितने भी बी लिम्फोसाइट्स उसमें से 85% लिम्फोसाइट्स है. B statement says B lymphocytes also undergo maturation. C statement says B stands for bursa fabricus in birds. Bursa fabricus in birds. While D states the germinal center of lymphatic follicle contains dividing B lymphocyte. So this is the question. You have 4 sentences and you need to identify the false sentence. Okay. So Dr. Poonam says A. Okay. Someone is also saying A. Let's try to solve this, right? Let's try to solve this MCQ. Okay. Anyone else? Okay. Let's see. So the correct answer, that is you need to identify the false statement, right? And the first one, that is the false statement. Okay, I know everyone is getting correct. You see, about 85% of the circulating lymphocytes are B cells. It is false. In blood, most of the lymphocytes are T lymphocytes and not the B. If you know, there are 2 types of lymphocytes, B and T, right? And you see, otherwise all statements are true. B lymphocytes also undergoes maturation. That is correct. They mature in bone marrows. C, B stands for bursa of fabricus. That is also true. And D, germinal centers contain dividing B cells. That is also true, right? So the false statement, that was 85% cells are B lymphocytes. No, that is incorrect. 70 to 80% are T cells. Correct? So correct answer is option A. We move further. Okay. Name the periosteal bone that completely covered the cartilaginous shaft. So, name the periosteal bone that completely covers the cartilaginous shaft.
Diaphysis.
Okay. Dr. Shalini says diaphysis. Okay. Anyone else? Is B. Okay. So the periosteal bone means bones that form the outer covering of bone, right? Outer covering of the bone, that is called as a periosteum, right? So it is a new bone formed on the outer surface of an existing bone, usually during the growth or healing, right? So the options are periosteal bud, periosteal collar, diaphysis, and cement line. Now let's try to understand now regarding these options. You see, first periosteal buds. What is periosteal buds? These are small blood vessels. Periosteal buds are small blood vessels and cells that grow from the outer covering of the bone, that we call as a periosteum. They help in bone formation and growth. That is periosteal buds. Regarding periosteal collar, it is a ring of new bone formed around a developing bone shaft. It gives strength and support to the growing bone. while the cement line is a thin line seen in a bone under a microscope. It marks a kind of a boundary between old bone and newly formed bone, right? And diaphysis, right? As someone mentioned regarding diaphysis, right? Diaphysis is present at the end, right? End of a long bone. End of a long bone contains a diaphysis, right? So let's try to understand the correct answer. So the correct answer, that is periosteal collar. You see, during bone development, a layer of bone forms around the cartilage shaft, and this layer is called as a periosteal collar. And it completely surrounds the cartilaginous shaft and it provides support, as we discussed now. Why others are wrong? You see, periosteal buds, as we discussed, it is a blood vessels and cell entering the bone, not the covering. Diaphysis, as we discussed, it is shaft of the bone. It is responsible for the growth of the shaft of the bone, not especially for the covering layer. Cement is a kind of a bone remodeling and not related to the covering. So, dear friends, option B, that is periosteal collar, is the correct answer. Okay, we move further. Okay, so following groups of cell are neuroglial cell, except, so you need to identify the group of cell which is not neuroglial cell. So option 1, option A, it is ependymal cell, Schwann cells. Option B, ependymal cells, oligodendrocytes. Option C, astrocytes, microglial cell. Option D, oligodendrocytes, dust cell. Right?
Sir, D,
So you need
oligodendrocyte,
to identify. Okay. Dr. Shalini says oligodendrocytes and dust cell. Okay. First, now let's try to understand what is neuroglial cell. Okay. Anyone else who want to answer? Dr. Kalpana says option D. Okay. Okay. Let's see. What is neuroglial cell first? Actually, the neuroglial cells are the supporting cells of the nervous system. Right? They do not carry signals like neuron, but they help protect and nourish neurons. Right? So these are the cells which are responsible for the nourishment of the neurons. Right? A kind of supporting system, right? Supporting cells of nervous system. Actually, you need to understand that they do not carry the signals like neuron, but they play the supporting role, like helping protection, nourishing the neurons, right? And you see, these are the groups, right? Among these, now, if you know ependymal cells, वो क्या होते हैं? They lines the cavities of the brain and help in movement of the cerebrospinal fluid. So वो तो आएगा, ठीक है? तो जहां पर भी ependymal cell है, तो that is correct. And astrocyte support neurons and help to maintain the environment around them. Then oligodendrocytes. Oligodendrocytes form myelin covering around the nerve fibers in the brain and spinal cord. Correct? And myroglia, it acts like an immune cell. They clean and protect the nervous system. Okay. Schwann cells, they are also the group of neuroglial cell as they form myelin around the nerves outside the brain and spinal cord. Okay. And satellite cells supports neurons in peripheral ganglia. So you see, all are these examples or are a group of cells of our neuroglial cells, except, right? Except, you see, oligodendrocytes, right? They are, as we correctly discussed, oligodendrocytes, they form the myelin covering So they are they are from the group of neuroglial cell, but
The
dust
screen is
cell.
not visible.
Acha, my screen is not visible, ma'am. Oh, just a minute. Like, is it visible, ma'am, now?
No, sir.
I am
No, sir.
my slides. Is it visible? Just okay. Is my slides is visible now?
Yes,
I
sir.
Yes,
Now
am
sir.
visible.
Yes,
changing
sir.
my slides. Okay. So as we discussed now, all are this a group of cells which are neuroglial. But dust cell, na? Dust cells, they are not the neuroglial cell. They are the alveolar macrophage in lungs and not in the nervous system. So you see in this, na, all were correct except the dust cell, which are a part of the respiratory system, part of a alveolar macrophage in lungs and not in the nervous system. So because of that, not because of just this dust cell, option D is the answer. Right? We move further. Middle radio ulnar joint. Now I am very sure those who have joined our regular classes, right, of ongoing classes, they will be very keen to answer this because they already know these answers. They have solved such kind of MCQs many times, right? So middle radio ulnar joint belongs to which type and variety? So anyone from
Sir,
the like
B5.
regular batch? Fibrous syndesmosis, correct, Dr. Shalini? Let's see. Let's wait for others. Okay. You see, is a joint between the radius and ulna in the middle part of the forearm, right? So you see in the forearm we have these two bones, na? Radius and ulna. In simple words, na, it is not typical moving joint, right? So there is a connection between them, but there is an as such exact joint नहीं present है, ठीक है? So, but you see, the what is the function of this joint? Function of the coordination is possible because of this radio-ulnar joint, right? And you correctly answered, doctor. So the correct answer, that is fibrous syndesmosis. The middle radio-ulnar joint is formed by the interosseous membrane between radius and ulna. So you see, because of this, na, though the one border of the radius, we called it as a interosseous border, the one which is very sharp. Why? Because the interosseous membrane is attached to it. Similarly, in the ulna, right, radius or ulna, दोनों में एक border ऐसी है that is very sharp, and that is why over there interosseous membrane, as interosseous membrane is attached to that border, na, we call it as an interosseous border. है ना? And the joint that is formed because of this interosseous membrane, that is fibrous syndesmosis, right? So correct answer is option B, that is fibrous syndesmosis. Okay, we move further regarding pars intermedia. Now this is slightly tricky, right? So regarding pars intermedia, all the statements are true except, so you need to identify the false statement. So first, that is most important feature is colloid filled vesicle. Second, that is some chromophobes are also present. Option C, that is secretion includes MSH, ACT, and dendrons. And lastly, well developed in human hypophysis. So this is all regarding pars intermedia, right? So you need to identify the incorrect. So who wants to answer this? This is slightly tricky. Okay, Dr. Richa
Sir,
says
D.
option D. Dr. Okay, Dr. Shalini also says D. Okay. Now you see, pars intermedia, that is a small middle part of the pituitary gland. In simple words, it lies between the anterior and the posterior pituitary, right? You see, what is the main function? It produces melanocyte stimulating hormone. If you know melanocyte stimulating hormone, that is actually melanocyte stimulating hormone, that is actually which helps in controlling the skin pigmentation.
इन्वर्टर ठप हो जाएगा देख चल रहा है बैठ के पंखा उनका सब ऑफ कर बैठ और कूलर इन्वर्टर पे ही चल रहा है
सर ग्रुप में बोल दे
So,
म्यूट कर ले
just please. Okay. And you see, it is a small sac-like structure that is filled with a thick gel-like substance called colloid, right? So, and what is chromophores? These are the cells in the pituitary gland that do not take stain well. Right? In simple word, they are inactive or resting cell that are not actively producing hormones. Correct? So you see, true. Right?
सर आपका साउंड क्लियर नहीं आ रहा।
Melanocyte stimulating hormone, right? So that is also true. But well developed, sorry? Okay. Well developed in human? No, it is false. In humans, pars intermedia is poorly developed. So many of you
आपका आवाज कट रहा है बार बार, आवाज को थोड़ा सही करिए।
answered option D, that so you are all correct. So correct answer is option नहीं आ रहा है ऐसा? Am I audible, everyone? Am I audible? Okay, just a minute, just a minute.
सुना है लेकिन
Okay. Am I audible now?
ये
We
बाकी
move further. Am I audible, friends?
जस्ट अ मिनट, जो बाकी अपना काम कर रहे हैं म्यूट कर लें।
Okay. We move further. So now the question is, name the avascular spot. Avascular spot or area on the surface of ovary due to underlying ovarian follicle just before the ovulation. So what we need to find avascular spot on or area on ovary, right? And you see just before the ovulation.
Yes,
right?
sir. Stigma is right.
Okay. So Dr. Shalini says option C, that is stigma, right? There is a small area on the ovary where there is no blood vessels, right? In simple word, it is a weak spot on the ovary surface where the mature follicles break, right? Ovulation occurs to release the egg. Right? Okay. Option C, Dr. Poonam says option C. Dr. Nisha says option. Okay. So, as you correctly said, na, you see, so the answer is option C only, that is the stigma, right? We move further. Following statement are true regarding Sartoli cells, except. So you need to identify false statement for the Sartoli cells. Okay. You see, first sentence, that is, they produce Mullerian inhibitory substance. Please, everyone, please be mute, right? Okay. Then it produces Mullerian inhibitory substance and androgen binding protein. B, they are less prominent in old age. Less prominent in old age. Then C, phagocytosis residual cytoplasm during spermatogenesis. And option D, the nucleus seen near the base with a prominent nucleolus. Right? So you need to identify the incorrect statement for the Sartoli cells. Anyone who would like to answer? Okay, let's see. Okay, Dr. Shalini says option C. Okay. So let's try to understand now these first Sartoli cells. What are Sertoli cells? These are the special supporting cells present in the seminiferous tubules of the testes. They help in growth and development of the sperm cells.
B also.
Okay. Dr. Om is also answering. Very good. Okay. What is the function of these Sertoli cells? That is, it nourishes and supports the developing sperm. It's form a protective barrier, helping sperm maturation, and secretes some hormones also. Now, if you know Mullerian inhibitory substance, right, that is also produced by Sertoli cell, right? It prevents development of female reproductive organ, Mullerian duct, right? Okay, please don't mark, please don't mark on the screen. Huh? It's my request, right? So androgen binding protein is also produced by the Sertoli cell, right? It keeps level high of testosterone, right? So androgen binding protein helps in proper sperm development, that is spermatogenesis, right? So what would be the correct answer?
B.
That is option B. That is less prominent in old age. So that the first sentence, that is also correct. Produce Mullerian inhibitory uh, Mullerian inhibitory substance. It also produces androgen binding protein, right? You see, phagocytosis of residual cytoplasm, they clean up leftover cytoplasm during spermatogenesis. So that is also true. These are typical features of Sertoli cell. That is, the nucleus near base has a. These are correct, but you see, less prominent in old age. No, Sertoli cells are related like germ cell, है ना? Germ cells become less prominent with increase in the age, but that is not the same in the Sertoli cells, right? So option B is correct. Okay. Now this is again very interesting. Histology of vermiform appendix, right? So regarding histology of vermiform appendix, you need to identify the incorrect sentence. So A option, crypts are poorly developed. Tinea coli, not present. Then Tinea collis, present. Longitudinal muscle coat is complete and equally thick all around. Right? So who wants to answer this?
Sir B. Tinea
Okay,
coli.
Tinea collis present. Okay, okay. Okay, so you are saying Tinea collis, coli not present. Okay.
C.
Sure. Anyone else who would like to answer?
C.
Okay. This is histology of vermiform appendix, na? The appendix look like the intestine but has a lot of lymphoid tissue. Okay, someone is answering. Okay. Option C. Okay. You see, main features. What are the main features of the vermiform appendix? Mucosa, lamina propria, submucosa, and muscular layer, and finally the serosa layer. Right? Tinea coli. Right? There are three narrow bands of smooth muscle present on the outer surface of the large intestine. Instead of full continuous muscle layer, the colon has three strips of the muscle. Right? They help in movement of the content in the large intestine and form sac-like pouch called as haustra, if you know this, right? So what would be the correct answer of this? Crypts are poorly developed, that is also correct. Tinea coli not present or Tinea coli is present? Tinea coli, that is not present. Tinea coli not present, that is true. Tinea coli present, that is false. So option C, Tinea coli is present, that is a false, right? We move further regarding histology of small intestine. What is true about Paneth cell, right? So you need to identify what is false of the Paneth cell, right? So option A, that is lining cells of small intestine include enterocytes and Paneth cell. Option B, Paneth cells are Zemgen cell. Option C, Paneth cell are rich in zinc. Option D, Paneth cells are also known as enterochromaffin cells. So you need to identify the false one.
C option. C.
C.
Okay.
C. Penicillin.
Okay, so you are saying regarding Paneth cell, the false set is option C, right? Correct, correct. You are right. Let's try to solve this now. Okay. So Paneth cell are the specialized cell present at the base of intestinal gland that you call as the crypts. Okay? They help in protection of the intestine and it secretes antibacterial substances like lysozymes. Right? So you see, lining cells of the small intestine includes enterocytes and Paneth cell. Paneth cells are zymogen cells, that means the cheap cell, right? They, in simple words, they produce inactive digestive substance and their function is to secrete pepsinogen, right? Okay. Paneth cells are rich in zinc. And lastly, Paneth cells are also known as enterochromaffin cells. Enterochromaffin cells means at a special cell present in the lining of intestine. They are hormone secreting cell. They produce serotonin, right? Which helps in movement of the intestine. Or in simple words, we can see it as a gut motility. And हम जो gut motility बोलते हैं, that is. So all are correct except option D. Right? You see, rich in zinc, that is also correct. Right? So enterocytes and Paneth cells present, that is correct. Both are normal lining cells of the small intestine. Paneth cells are zymogen cells, that is also true. Rich in zinc, that is also true. But they called as an enterochromaffin cells, that is false. Paneth cells are not called as enterochromaffin cells. Enterochromaffin cells are neuroendocrine, right? So option D. So option D is the answer and not the option C. Okay. Now you see which statement regarding sonic hedgehog is not true? Okay. So regarding sonic hedgehog is not a true. पहले तो what is sonic hedgehog? Sonic hedgehog is a signaling protein, है ना? Important in embryonic development, embryology, right? It's a kind of it gives instruction to the cells about how to grow, divide, and form different parts of the body. It helps in proper formation of brain, limbs, and organ during early development. Right? So, what are the options? Option A says act as a master gene cell for embryogenesis. B says act as a morphogen. C says SHH protein are released to development of vasculature, adaptosis, and epithelial to mesenchymal transition. And option D, after transduction, the protein is cleaved and cholesterol is added to its C terminus of the N terminal domain. So you need to identify the false statement. Who wants to answer this? Let's see. D. Dr. Poonam says D. Okay. Sapna ji says B. Okay. So see, first act as a master gene. Master gene means control many other gene, like a boss gene, na? Morphogen, it is a substance that controls how cells develop based on its concentration. Right? Sonic hedgehog act as a morphogen during embryonic development. है ना? So option B. Okay, let's try to solve. Act as a master gene, that is also true. As we discussed, act as a morphogene, that is also true. Involved in vasculature, apoptosis, EMT, that is also true. But you see, last cholesterol added to C terminus of N terminal domain, that is false. Cholesterol is added to the C terminus of the N terminal fragment, but the statement is incorrectly worded and conceptually wrong. So option is correct. Name the factors which produce differentiation of cell of embryoblast in hypoblast
Sir,
and
previous slide back कर दो.
sorry. This one?
Yes, sir.
Okay. We move further now. Name the factor which produce differentiation of cell of the embryoblast in hypoblast and epiblast. Option A, bone morphogenic genetic fact. B, fibroblast growth factor. C, WNT protein. And D, follicle stimulating hormone. So name the factor which produces the differentiation of cell of embryoblast into hypoblast and epiblast. Okay, let's see who has given the right answer. Dr. Poonam says option B. Okay.
B, sir, fibroblast growth factor.
Fibroblast growth factor, है ना? Okay. You see, first, what is hypoblast and epiblast? These are the two layers of the cell formed in the early embryo. Epiblast, if you know, it is the upper layer which forms the entire embryo, or you can say baby's body, right? And which give rise to all three germ layers like ectoderm, mesoderm, endoderm. And if you know hypoblast, it is a lower layer, does not form the embryo. It helps in forming yolk sac and support structure. Right? So you can brief it as epiblast make the baby, while hypoblast help in support. Right? WNT protein, these are the signaling protein. which are important in development, right? They send message to cells telling them how to grow, divide, and take proper shape, है ना? इसका फंक्शन यह रहता है कि एम्ब्रियोनिक का डेवलपमेंट करें, सेल डिफरेंशिएशन करें, ठीक है? इट हेल्प्स इन फॉर्मेशन ऑफ बॉडी पैटर्न एंड ऑर्गन, है ना? So the correct answer is B, because fibroblast growth factor helps in differentiation of embryoblast into epiblast and hypoblast. So correct answer is option B, that is fibroblast growth. During molecular regulation of somite differentiation, again, molecular regulation of somite differentiation, right? Signals are received from the following nearby structures except. So कहां से रिसीव नहीं होते हैं, ठीक है? So option A, lateral plate mesoderm. Option B, notochord and neural tube. Option C, neural tube and epidermis. And option D, intraembryonic column. पहले तो what is somites? चलो, anyone wants to answer this? Okay, Dr. Poonam says D. Okay, Vivo says A. Okay, Dr. Shruti says B. अच्छा, वो तो previous. Okay. So let's try to understand now. What is somite cell? Somite gets instruction from, okay, nearby tissues to decide what they will become, right? Main signals come from notochord, help from sclerotum, that means bones. It signals also come from the neural tube, which helps in differentiation. It also comes from the surface ectoderm, which influence the dumb layer, that means the skin. Lateral plate of mesoderm helps in forming muscles, that is a myotome, right? So इसमें से कहां से सिग्नल नहीं आते, that you need to identify, right? So option D, option B. Now let's see the correct answer. You see, it comes from the node and neural tube. It comes from the lateral plate mesoderm. It comes from the neural tube and overlying ectoderm, but it doesn't come from the intraembryonic coelom. Does not provide signaling form for somite differentiation. So option D is correct. Move further. Okay. Splanchnopluric mesoderm. Again, splanchnopluric mesoderm gives rise to all the following except. So I am talking regarding splanchnopluric mesoderm. So option A, that is mesothelial lining of pleura. Option B, that is blood and blood vessels. Option C, that is lymph cells and lymph vessel. And option D, ligament and tendon. So आपका क्या कहना है आंसर? Option D. All are saying option D, right? This is splanchnopluric mesoderm. It is the inner layer of the mesoderm that is attached to the endoderm, and it has its function to form organs, viscera especially, like intestine, heart, and blood vessels, right? While somatopluric mesoderm, that is the outer layer of the mesoderm, है ना? Okay. So you all are saying ligaments and tendon. So the correct answer is ligaments and tendon. It gives rise to mesothelial lining, blood and blood vessel, lymphatic system, but it is not giving this to ligaments and tendon. So option D is correct. Following are the anomalies of placenta. according to the attachment of umbilical cord. So, following are the anomalies of placenta according to the attachment of umbilical cord. Battledore placenta, fenestrated placenta, velamentous placenta, and placenta furcated. Right? So what is correct? Okay, Dr. Poonam says option B. Okay. So these all are the, you see what is asked. These all are the abnormal ways in which the umbilical cord is attached to the placenta. Abnormal
Sir,
ways.
B,
So it is,
fenestrated.
okay, fenestrated placenta you are answering. Okay. You see, what are the types of these anomalies? Central
सर
insertion.
ये वेलामेंटस बेटल डोर वाला ही मतलब ये साइड वाला है क्या शायद इसमें हम लाइक
Okay. Okay, let's see. Battledore placenta क्या है? Battledore placenta, that is condition where the umbilical cord is attached to at the edge, है ना, margin of placenta instead of center. तो उसे हम कहते हैं battledore. ठीक है. So let's see the correct answer. As you correctly mentioned, option B, that is fenestrated placenta. Right? You see, battledore, marginal attachment of the umbilical cord. Velamentous के अंदर क्या होता है? Cord attaches to the membrane. ठीक है. Velamentous, in simple word ना, umbilical cord does not directly attach to placenta. Instead, the blood vessels run through the fetal membrane first and then reach the placenta. So because of this, what is the problem? These exposed vessels are not protected, so they can tear and rupture easily. उसको protection नहीं मिला तो कभी भी tear and so it gets ruptured easily, right? And lastly, fenestrated, so defect in the placental tissue not related to the cord attachment. The answer is fenestrated placenta. So chemical agent that can cause mutation in male germ cell. So you need to identify the chemical agent.
रेडिएशन
Ethyl nitrous urea, radiation, none or all. तो ये तो सिंपल है. Mutation in male germ cells. Dr. Poonam says option A. So correct answer is A, right? Option A is correct. Ethyl nitrous urea is a potent chemical mutation that specially induces mutation in male germ cell. Radiation is a physical agent, not a chemical. That is very obvious. Maternal obesity has association with following fetal malformation except, मतलब you need to identify के maternal obesity in which it is not associated with fetal malformation, right? So option A, neural tube defect. Option B, congenital defect in heart. Option C, omphalocele. Option D, limb defect. So what is the correct answer of this? Dr. Archana says option A,
सर डी लिव
limb defect. Omphalocele means, किसी को पता है? If anyone wants to answer omphalocele, what is omphalocele? Option C. Omphalocele,
सर ये ओमेंटम से
omentum nahi. You see what happens when the baby's intestine and sometimes other organ, right, come out of the abdomen at birth, but they are covered by thin membrane. है ना? And this all occurs at the umbilical region. And this occurs because failure of intestine to return in the abdomen during development. right? So let's see the correct answer. Answer is option D. That is limb defects. किसी ने limb defect बताया था, बोला था. That is the correct answer, right? Non-invasive prenatal screening technique to Down syndrome. Again, you see prenatal screening technique. It is mentioned regarding screening technique. Huh? Okay. Option A, maternal serum alpha fetoprotein. Just a minute. Huh? Sorry. So, what is the correct answer of this?
D.
D. Okay. You see, option A, that is maternal serum alpha fetoprotein. Option B, ultrasound. Then option C, that is chordocentesis. Chordocentesis, right? And option D, that is Neckel translucency test. Okay, let's see the correct answer. So the correct answer is option C and not the option D, right? You see, you are saying that knuckle translucency testing, right? But the correct answer is chordocentesis because it's an invasive as it involves sampling fetal blood from the umbilical cord. है ना? So option C is the correct. Okay, चलो ये थोड़ा tricky है. The limb bud formed at the end of 4th week of intrauterine life with progress in the order. You see at the end of 4th week, है ना, 4th week of intrauterine life. तो पहले ऑटोपैड, जिगोपैड और स्टाइलोपैड. तो उसके अंदर करेक्ट ऑर्डर ऑटोपैड, जिगोपॉड, स्टाइलोपॉड. तो करेक्ट
Sir,
ऑर्डर क्या रहेगा? Okay, stylopod. So Dr. Shalin saying stylopod, zygopod, and autopod. Okay.
Excuse me, sir, I missed the answer of the previous question. What was the answer of the previous question?
Chordocentesis.
Okay, sir.
Okay. So let's try to solve this now. Okay. So correctly mentioned by Dr. Shalini, correct answer is option C, right? So first that is a stylopod. Means development, you see limb development occurs from proximal to distal, right? मतलब जो नजदीक है वो पहले, डिस्टल जो डिस्टेंस पर है वो बाद में होंगे, ठीक है? So stylopod, from that there is arm and thigh development. Zygopod, forearm and leg, and autopod, that is hand and foot. So correct sequence is stylopod, zygopod and autopod. स्टाइलोपॉड ना, अगर आपको अगर सिंपल लैंग्वेज में बताए तो अपर पार्ट ऑफ लिम्ब का रिलेटेड होता है. जिगोपॉड दैट इज रिलेटेड टू मिडल पार्ट ऑफ द लिम्ब लाइक फोर आर्म, रेडियस एंड अल्ना. और लेग के अंदर होगा तो टिबिया एंड फिब्यूला. ऑटोपॉड दैट इज रिलेटेड टू डिस्टल पार्ट, फॉर एग्जांपल हैंड एंड फिंगर और फुट एंड टोज, है ना? So this is interesting. Regarding Robertsonian translocation. Robertsonian translocation, all statements are true except A. The short arms of two non-homologous chromosomes are lost. Long arm fuse at the centromere. This type of translocation confined to metacentric chromosomes. And D. Most common Robertsian translocation involves in the fusion of the long arm chromosome number 14 and 21. पहले तो what is Robertsonian translocation? It is a chromosomal abnormality, just to brief it, where two chromosomes join together. है ना?
सर बी और सी में थोड़ा कंफ्यूजन है कि फर्स्ट तो सही है और डी भी सही है, क्योंकि
First word D
रॉबर्टसन
सही
में
है.
लॉन्ग आर्म क्रोमोसोम नंबर 14 21 होता है।
13, 14, 15, 21, 22 तो होता है ना? तो 14 and 21 तो है. Okay. Option C. Dr. Poonam says option C. Okay. You see, Robertsonian translocation. What happens that the long arm of two chromosomes fuses, but the short arm are lost. है ना? तो उसके अंदर होता क्या है? Person may look normal, but it can cause genetic disorder like Down syndrome. है ना? तो you see there is a like constant problem है कि risk of genetic problems in offspring आएगा. ठीक है, तो let's see correct. So as you mentioned correctly, the answer is option C, right? You see, short arm loss, that is also true. Long arm fuses, that is also true. Confined to metacentric chromosome, no, it is false. You see, Robertsonian translocation occurs in acrocentric chromosome and not the metacentric. और जैसे हमने डिस्कस किया ना, इट इज 13, 14, 15, 21, 22 ये सब इन्वॉल्व होते हैं. तो 14 and 21 आर द मोस्ट कॉमन, सो दैट इज करेक्ट. सो ऑप्शन सी. फर्स्ट आइडेंटिफाइड ट्यूमर suppressor gene. So you need to identify first identified tumor suppressor gene. So what is the correct answer? A. Okay. So correct. You are correct. RB1 gene, है ना? You see, RB1 gene was the first tumor suppressor gene discovered, associated with retinoblastoma, है ना? Okay. चलो ये थोड़ा सिंपल है. Clinical features of Turner syndrome includes all except. So clinical features of ये थोड़ा सिंपल है यार, ये इसका तो आंसर.
वेब नेक.
वेब में. अच्छा.
डी.
डी. करेक्ट है ना? You see, web neck, broad shield like chest, short stature and moon face. पहले तो ये मोनोसोमी है, 45X रहता है ना? नॉर्मली फीमेल से XX, बट हियर देयर इज ओनली वन X, so डेवलपमेंट इज अफेक्टेड. मेन फीचर्स क्या रहते हैं? शॉर्ट स्ट्रेचर होता है, वेब नेक, देयर इज आल्सो ब्रॉड चेस्ट, स्ट्रिक ओवरीज, और यू कैन से इनफर्टिलिटी, है ना? प्राइमरी एमेनोरिया भी. इंटेलिजेंट, दैट इज यूजुअली नॉर्मल बट मे हैव माइल्ड लर्निंग डिफिकल्टीज. एंड यूजुअली हम डायग्नोसिस कैरियोटाइपिंग से ही करते हैं, नहीं? सो करेक्ट आंसर इज मून फेस, राइट? That is not a feature, right? It is seen in the conditions like Cushing and not the Turner syndrome, है ना? चलो नेक्स्ट वन रिगार्डिंग 47XYY syndrome. Again, you note it down. 47XYY syndrome. Which statement is true? Seen in about 1 in 1000 females and male. Okay, so when you see the ratio between females and male, that is 1 to 1000. Patients with this syndrome exhibits minor behavioral abnormalities like hyperactivity, attention deficit, and learning disorder. Males with this syndrome are taller than the average. And lastly, all options are correct. So what is true?
D. So D.
D. Okay. Okay. You see, 47XXY is a genetic condition in male where there is a one extra Y chromosome, right? And
So this
it
is a
occurs in
Klippinter syndrome.
correct, right? So you see, mainly occurs. So option D is correct. All are correct, right? Occurs in 1 in 1000, more in males, and may show mild behavioral issues like ADHD. Individuals are usually taller than the average, right? So okay. Disease caused due to defect in DNA repair. DNA repair, right? Chalo, answer this.
D.
Sorry, Dr. Poonam?
D, all of the above.
Okay. Okay, okay. So, xeroderma pigmentosum is a rare genetic disorder which in the body cannot repair DNA damage caused by sunlight, है ना? Usually इसके अंदर क्या होता है? Our body repairs damage caused by UV light. But in this condition, the repair system doesn't work. तो repairing नहीं हो सकता. ठीक है? Then the second, there is a Bloom syndrome. Again, it is a autosomal recessive and mutation of BLM gene रहता है उसके अंदर, right? तो यूजुअली इसके अंदर शॉर्ट स्ट्रेचर रहेगा, सन सेंसिटिव स्किन रैश, नैरो फेस, ऐसा सब रहेगा. ठीक है. सो द करेक्ट आंसर इज ऑप्शन डी. All are due to DNA effects. You see, Werner syndrome. Again, Werner syndrome is also autosomal recessive and progeria जिसे हम कहते हैं, है ना? If you know the movie that is पा, इसके अंदर इसके रिलेटेड है progeria. ठीक है. Which of the following statement is correct regarding cephalic vein? It begins at the radial extremity of the dorsal venous arch of hand. It ascends along the middle aspect of the arm, and lastly it enters the axillary vein just distal to the clavicle. So you need to identify the correct sentences. If you know this vein, cephalic vein, is a superficial vein of the upper limb. Chalo. So who wants to answer this? Let's see the answer. You see, begins at the radial side of the dorsal venous arch. That is correct. You see, lateral side of the dorsal venous arch, right? Cephalic vein starts on the lateral side, right? Ascends along the medial aspect. That is false. It runs on the lateral side, not the medial. Again, all the third that is also correct is axillary vein near clavicle. That is also true, as it drains into the axillary vein just below the clavicle. So it is on the lateral side, not the medial. So option C is correct. Okay. Which of the following statement about axillary nerve is not correct? Axillary nerve. It is a branch of posterior cord of the brachial plexus. It supplies deltoid and teres major. It winds around the neck of humerus along with the circumflex scapular vessels. So you need to identify the incorrect. Axillary now, the most important of the shoulder region, है ना? Option A, only 1 and 2. So you are saying it is a branch of posterior cord of the brachial plexus. It is not a branch of posterior cord of brachial plexus and it does not supply to deltoid and teres major. Okay. Anyone else who would like to answer? Okay. You see, axillary nerve, it arises from the posterior cord of the brachial plexus, right? So the root value it is C5 and C6, so that is correct. It supplies deltoid and teres major. No. Right? It supplies deltoid and teres minor and not the major. It winds with the circumflex scapular vessels. It is also false. It passes with the posterior circumflex humeral vessels and not circumflex scapular. So you see, second and third statements are incorrect. So option B, that is the answer. Option B. Okay. Which of the following approaches can produce anesthetic blockade of the brachial plexus? Anesthetic blockade of the brachial plexus. Right?
So second and third, C.
Okay. Interscalena root, supraclavicular root, axillary root. So आपका क्या कहना है मैम? Dr. Monica says D.
D.
Okay. Okay. What is anesthetic blockade? Na? It is a technique used to produce regional anesthesia of the upper limb for surgeries. Instead of giving general anesthesia, they usually inject local anesthetic around the brachial plexus. Common sites
X-ray
of the
route भी
block
तो
is
सही है.
interscalene block, supraclavicular block, infraclavicular block, axillary block. Right? So the correct answer is all are correct. All are correct. So option D is the answer. So you need to identify the correct for the brachioradialis. So what is the answer? It is innervated by the radial nerve. It is the flexor of the elbow. It acts most effectively with the forearm in the supine position.
Sir, D.
Sorry?
Sir, D.
A.
D?
A.
All of the above? Option A. You see, it is innervated by the radial nerve. That is true. Brachioradialis is supplied by the radial nerve. It is flexor of elbow. That is also true. But most effective in supine position, that is false. It works best in mid pronation and not full supination. So option A is correct. That is only 1 and 2. Right? Which of the चलो ये तो हमारे रेगुलर बैचेस वालों को आना ही चाहिए. Which of the following is the most frequently fractured carpal bone?
Is scaphoid.
Scaphoid.
Thank you.
Scaphoid.
Scaphoid.
We have taken that lecture on this of a scaphoid bone, and we discuss a lot regarding that necrosis also. So the answer is scaphoid. That is the most commonly fractured carpal bone, usually due to fall on outstretched hand. And ये discuss हुआ था. This can lead to avascular necrosis. Which of the following statement about trigger finger is not correct. Trigger finger, right? So what is first trigger finger? Is a condition where a finger gets stuck in the bent position and then sudden snaps when straightened. Okay. So you need to
Second and third
identify
both.
which is not correct. Okay, second and third.
Sir, only third D option is correct.
Which
Corresponding.
option? Okay. So see, what is the cause of this? Usually thickening of the flexor tendon, right? And what happens usually fingers bends normally, but while straightening na gets stuck. So stuck ho jati hai. Then suddenly release with a snap. So that occurs in the trigger finger. Repeated hand use, diabetes और rheumatoid arthritis की वजह से भी ये हो सकता है. यूजुअली पेशेंट क्या बोलेगा सिम्टम कि पेन एट द बेस ऑफ फिंगर, है ना. तो फिंगर गेट्स लॉक एंड देन रिलीजेस विथ अ क्लिक, इसलिए हम इसको क्या बोलते हैं, ट्रिगर फिंगर. So stenosing tenovaginitis, that is true. Trigger finger is due to narrowing of the tendon sheath and affect the fibrous flexure sheath, that is also true. But extensor muscle sufficiently powerful, that is false. Extensor occurs with difficulty, not because extensor is sufficiently powerful, है ना. So correct answer, that is option D, only 3. Third sentence, that is not correct, that is false. What is the level of origin of first dorsal metacarpal artery? Again, first dorsal metacarpal artery from the radial artery. तो कहां से वो ओरिजिन होता है? ठीक है. So just before it passes between the head of first dorsal interosseous, during the course between the head of first dorsal interosseous, just after it emerges between the head of the first dorsal interosseous, and option D, between first and second lumbricals. If you know, the first dorsal metacarpal artery is an important vessel supplying the thumb. Okay, Dr. Monica is saying A. It runs along the dorsal aspect of the first metacarpal, if you know. And it supplies the thumb lateral side of the index finger. Right? Okay. So you are saying option A. Let's see. So the correct answer is A. Just before it passes between the head of first dorsal interosseous. Right? The first dorsal metacarpal artery arises from the radial artery just before it passes between the two heads of the first dorsal interosseous muscle. Which of the following statements are correct about lymphatic drainage of lower limb? Right? Lymphatic drainage of lower limb. Lymph from the lower limb passes from the inguinal nodes to the external and the common iliac nodes. Deep gluteal lymph passes through the internal and common iliac chains. Peripheral nodes are few and all are superficially placed. So you need to find the correct sentences. तो क्या आएगा?
All of above.
Okay, so let's try to solve this. Inguinal message आता है external and common iliac nodes, so that is true. Lymph from the lower limb follow this pathway. Then you see second, that is deep gluteal lymph to internal and common iliac जाता है. So deep structures drain into internal iliac node, that is also true. But there are both superficial and deep nodes. Not all are superficial, है ना? So third sentence, that is false. So in this, option B is correct. Right? So third sentence is false. So 1 and 2 are correct. So option B is correct. Which of the following statements about femoral venous cannulation? So the question is regarding femoral venous cannulation. is not correct. It is an easy procedure. It supplies ready access to the right atrium. And last, it is a popular for long-term cannulation because of lower incidence of thrombosis and sepsis.
C.
क्या आएगा? If you know, needle is inserted just medially to femoral artery pulsation, below the inguinal ligament. क्या आएगा आंसर? ओके, ऑप्शन सी, बट नॉट श्योर. ओके, लेट्स सी.
सर
इट इज
ये
इजी.
इजी प्रोसेस तो नहीं होना चाहिए।
ओके, इज ए इजी प्रोसीजर है ना, ये इजी प्रोसीजर है. femoral vein cannulation is relatively easy, especially in emergency. Ready access to right atrium, yes, because it provides direct venous access. If you know, venous drainage directly
सर
goes
ये
into
जो
the right atrium.
हेलो
हाँ, yes.
सर, ये जो फीट में फिमोरल वेन्स में कैनुला लगाते हैं वही वाला कह रहा है क्या ये, इसलिए
सॉरी, आपका क्वेश्चन नहीं पता चला.
फिमोरल वेनस कैनुलेशन इज इजी प्रोसीजर, फर्स्ट ऑप्शन। तो मतलब सर ये जो फीट में फिमोरल्स में कैनुला लगाते हैं उसी को कह रहा है ना, इसलिए
हाँ हाँ
इजी।
हाँ, करेक्ट करेक्ट करेक्ट.
हाँ, आप समझ में आ गया, ठीक है सर, इजी।
Okay, okay. So it's an easy procedure or direct venous access, venous drainage, right atrium. So preferred for long-term use, that is false. It has higher risk of infection and thrombosis. It is not preferred for long-term cannulation. So options. So the third sentence, that is not the correct. So only three. So option C is correct. Which of the following muscles are attached to greater trochanter of femur? If you remember, upper end of the femur has two trochanters, greater and lesser. Greater trochanter has attachments of which muscles? So vas major and iliacus, vastus lateralis, vastus intermedius, vastus medialis and vastus intermedius, and lastly gluteus medius and gluteus minimus. ये बहुत ही डीप में से क्वेश्चन पूछा है इन्होंने. ये ये थोड़ा टफ है. Gluteus medius and minimus. Okay.
Gluteus medius.
So correct answer, that is gluteus medius and minimus are attached to the greater trochanter. Because vas major and iliacus are attached to lesser trochanter. Vastus muscle arises from the shaft of femur and not the greater trochanter. है ना? You see all vastus muscle. Out of this, na, while dissection, you can see vastus intermedius. Oh my God, it is so deeply present, almost completely attached to the femur. है ना? These all are attached to the shaft of the femur, right, and not the greater trochanter. चलो, ये तो आना ही चाहिए रेगुलर बैच वालों को. We discuss regarding this clergyman's knee. इसके बारे में डिस्कस भी हुआ था. रिगार्डिंग clergyman's knee.
Infrapatellar bursa.
ओके ओके. तो ऑप्शन ए,
A.
इंफ्रापटेलर बर्सा, सबक्यूटेनियस प्रीपटेलर बर्सा, सेमी मेम्ब्रेनस बर्सा और पेस बर्सा.
सर एक हाउस वाला नी वाला होता है, एक
हाँ,
क्लर्जी में।
ये हमने स्पेशली इसके लिए 2 स्लाइड्स अलग से किया था, याद हो तो. हाउसमेट्स नी और क्लर्जीमैन्स नी.
हाउसमेड प्री पैटलर हो गया और इंफ्रापैटलर क्लर्जी हो गया.
ओके. सो क्लर्जीमैन्स नी refers to inflammation of infrapatellar bursa, है ना. Prepatellar bursa, that is housemaid's knee, right? So option A, the infrapatellar bursa, that is correct. Fibrous capsule of the hip joint. In enter superiorly, thick posterior inferiorly. Capsular attachment to the femur lies well distal to the growth plate of the femoral head, both anteriorly and posteriorly. It is straightened by iliofemoral, pubofemoral, and ischiofemoral ligament. Option C, option C. Okay. So you are saying first sentence that is incorrect. It is thin anterior superiorly and thick posterior inferiorly. Rest of the second and third that are correct. Okay, let's see. So correct answer is C. Thin anterior superior. हाँ जैसे बताया कि first sentence that is false. The rest are correct. Which of the following statements are incorrect about the congenital talipes equivarus? चलो रेगुलर बैचेस वालों ये आना चाहिए. Equinovarus. Heel is elevated and turned inward. Both bones and soft tissue are affected. Talus has a foreshortened neck and an increased body neck angle. थोड़ा ट्विस्ट करके पूछा है ये. क्या आएगा? ऑप्शन बी.
Heel is elevated, ये भी सही है, लेकिन both unaffected are affected, not right. C हो
Okay.
सकता है सर.
Okay. Let's try to see the answer. Heel is elevated and turned inward. That is correct. Bones and soft tissue affect. That is also true. But see, talus changes. You see, ये sentence में क्या है? Talus has foreshortened neck. तो ऐसा नहीं है ना. Talus के अंदर कोई changes नहीं है. So talus changes are false. Talus changes are not like this. Foreshortened neck and increased body neck angle. No, this is wrong. So third sentence that is incorrect. So first and second are correct. So option B is correct. Which of the following statements about lymphatic drainage of mammary gland is not correct? Axillary node. चलो ये आंसर जो पेक्टोरल रीजन है उसमें से ये क्वेश्चन पूछा है. एक्सिलरी नोड एक उसके अंदर ये टॉपिक है मेमोरी ग्लैंड और ब्रेस्ट का, उसमें से ये है. Axillary nodes receives more than 75% of the lymph from the mammary gland. Surgically, nodes are described in relation to the pectoralis major. Seroma is the most common post-operative complication of axillary lymph node dissection in breast cancer. So you need to identify incorrect. So after an operation or trauma, some empty space is left in the tissue. है ना? The body sometimes fills this space with fluid, and this fluid collection is called as a seroma. Okay, option A. Let's see. Axillary nodes receives more than 75%. That is correct. Majority of the breast lymph drains into axillary. Nodes described in relation to pectoralis major. No, it is in relation to the pectoralis minor and not the major. Seroma is most common complication. False. Though common, it is not considered the most definitive, only major complication in this context. So option D is correct. 2 and 3. Which of the following structure form the left border of the mediastinal shadow? Left border of the mediastinal shadow in the posterior-anterior view of chest radiograph. Again, na? Mediastinal shadow in the posterior-anterior view of chest radiograph. Option A, left subclavian artery. Option B, aortic arch. Option C, left auricle. Option D, left ventricle. If you know, in posterior PA view, right, the mediastinal shadow is a central dense area between the two lungs field. It is formed by several important structures lying in the mediastinal. अगर आपको पता हो सुपीरियर मीडियासिनम शेडो किससे फॉर्म होता है, ट्रेकिया, एओर्टिक आर्ट, सुपीरियर वीना के वजह से. मीडियल मीडियासिनम, हार्ट, असेंडिंग एओर्टा, and I guess pulmonary trunk. Posterior mediastinum, if you remember, descending thoracic aorta and esophagus. No, no. Okay. So what is correct answer? Okay. All of the above. So the correct answer is all of the above, right? PA chest X-ray, the left mediastinal body is formed by left subclavian artery, aortic arch, left auricle, left ventricle. So all options are correct. Which of the following statements about the anatomical apex of the heart? Again, anatomical apex of the heart is not correct. It is directed downward, forward, and to the left. It is located in the fifth left intercostal space near or a little medial to the mid-clavicular line. Little medial to the mid-clavicular line. It is not overlapped by the left lung and pleura. So ये थोड़ा easy है. Option A. Okay, option D. Okay, directed downward, forward, left, that is correct. Located in the fifth space, that is also correct. Not overlapped by the left lung and pleura, that is false. Apex is overlapped by the lungs and pleura. So hence only third statement is incorrect. So option C is correct. Chalo, this is regarding triangle of Koch. Which of the following does not form the boundary of the triangle of Koch? Triangle of Koch, है ना? चलो, अगर किसी को पता है ट्राइंगल ऑफ कॉच इज एन इंपॉर्टेंट एनाटॉमिकल एरिया राइट एट्रियम में, और बाउंड्रीज कौन सी चीज बनाती है, तो यू नीड टू आइडेंटिफाई विच डज नॉट फॉर्म द बाउंड्री ऑफ ट्राइंगल. चलो पहले तो किससे बनती है? टेंडन ऑफ टेडरो, सेप्टल लेफ्ट वेल्ट ऑफ द ट्राइकस्पिड वाल्व, एंड ओपनिंग ऑफ द कोरोनरी साइनस, राइट? Okay, okay. So you need to identify which is not. Okay. So correct answer is option A. Tendon of Toledo, septal cusp of tricuspid valve, and anteromedial margin of coronary sinus opening. These all forms the border. But posterolateral margin of the coronary sinus is not a boundary. So correct answer is option A. Okay. Correct answer is option A. Okay. So by this now we have solved and really interesting, and I would say very difficult. But I would like to appreciate all you, right? That you were very much focused, right? And if you want, if you want to be very good in solving such kind of MCQs, na, you join our regular batch, because regular batches has like constantly ऐसे ही MCQs है, ऐसे ही topics हम discuss करते हैं, right? So that's it from my side, right? I hope this session was interesting to you, and
Thank you,
it
sir.
has developed a bit interest, right? Okay, okay. So that's it from my side. Thank you all.